Question 1. In the context of radiographic image evaluation, which of the following factors most directly affects the contrast of an image? A. Patient body size. B. Film screen system used. C. Kilovoltage peak kVp. D. Image receptor type. Answer. Correct answer. C. Kilovoltage peak kVp. Explanation. The contrast of a radiographic image is primarily influenced by the kilovoltage peak kVp. Increasing kVp results in a lower contrast image due to the broader range of X-ray energies produced, which can penetrate various tissue densities more uniformly. Conversely, lower kVp increases contrast by producing a greater difference between the various tissue densities. The other options, while potentially impactful on image quality, are less directly related to contrast. Patient body size, for instance, may affect image quality due to attenuation but does not directly control contrast, and the type of image receptor affects image acquisition more than contrast itself. Question 2. Given the circumstances of using a mobile X-ray unit in a hospital ward, what is the primary consideration for ensuring radiation safety for the healthcare worker? A. Using a portable lead apron for all radiographs. B. Maintaining a 6-foot distance from the patient. C. Standing behind a lead shield or barrier. D. Reducing the exposure time for each image. Answer. Correct answer. C. Standing behind a lead shield or barrier. Explanation. Radiation safety is paramount in the context of mobile X-ray use. The most effective way to ensure safety for healthcare workers is to utilize shielding such as lead barriers or shields during exposure. This is because the worker is more at risk of scattered radiation, which occurs when the X-rays interact with the patient or surrounding structures. Maintaining a 6-foot distance, important, does not provide the same level of protection from direct or scattered radiation as a lead barrier. Reducing exposure time or using a portable lead apron are helpful but are secondary to the use of physical shielding. Question 3. When considering the principles of radiographic positioning, which of the following statements about the alignment of the X-ray tube, body part, and image receptor is most accurate? A. The X-ray tube should be aligned perpendicular to the body part being imaged, regardless of the image receptor orientation. B. The body part must be aligned parallel to the image receptor for every projection. C. The X-ray tube, body part, and image receptor must be aligned to ensure accurate representation of the structure. D. The image receptor should be positioned based solely on the patient's comfort, regardless of anatomical considerations. Answer. Correct answer. C. The X-ray tube, body part, and image receptor must be aligned to ensure accurate representation of the structure. Explanation. Proper alignment of the X-ray tube, body part, and image receptor is critical in achieving an accurate radiographic image. Misalignment can result in distortion or poor visualization of the area of interest. The X-ray tube must be positioned to ensure that the beam is perpendicular to the area being and the image receptor, ensuring minimal distortion. While patient comfort is important, it should never override proper positioning, which is fundamental to obtaining diagnostic quality images. Question 4. To what extent does the use of automatic exposure control (EEC) systems reduce the radiographer's role in selecting exposure parameters? A. EEC completely eliminates the need for selecting kVp and mass. B. EEC helps regulate exposure time, but the radiographer still selects kVp and mass. C. EEC only works with film-based systems, not digital imaging. D. EEC adjusts all exposure factors automatically, including AVP and mass. Answer. Correct answer. B. EEC helps regulate exposure time, but the radiographer still selects kVp and mass. The explanation. Automatic exposure control (EEC) systems primarily control the exposure time and sometimes the milliampere seconds mass based on the amount of radiation detected by sensors within the image receptor. However, the radiographer is still responsible for selecting the appropriate kVp and mass, which determine the energy and amount of radiation produced by the X-ray tube. This process helps to reduce the risk of overexposure or underexposure, but the radiographer's expertise is essential in ensuring optimal imaging conditions. Question 5. Mr. Thomas, a 68-year-old patient, presents for a chest X-ray. During the examination, the radiographer notices Mr. Thomas has A significant degree of kyphosis. What is the best approach to ensure accurate imaging of the thoracic spine in this scenario? A. Just the KVP to a higher value to compensate for the body changes due to kyphosis. B. Angle the X-ray tube to account for the curvature of the spine. C. Use a lower mass to minimize patient exposure. D. Position the patient to stand straight despite the kyphosis to reduce image distortion. Answer. Correct answer. B. Angle the X-ray tube to account for the curvature of the spine. Explanation. In patients with kyphosis or similar spinal deformities, the radiographer must adjust the positioning to avoid distortion and ensure that the thoracic spine is accurately visualized. One common adjustment is to angle the X-ray tube to compensate for the curvature, which will help to minimize image distortion and ensure diagnostic quality images. While adjusting KVP might be necessary in some cases, it is primarily the positioning, i.e., angling of the tube, that addresses the anatomical changes due to kyphosis. Positioning the patient to stand straight is often not feasible and may lead to poor quality images. Question 6. When evaluating radiographic images for diagnostic quality, which of the following factors would most likely indicate a problem with the exposure technique used? A. Clear visualization of soft tissues with minimal noise. B. High contrast with well-demarcated borders of structures. C. Uniform density across the entire image with no areas of overexposure. D. Presence of visible overexposure or underexposure artifacts in specific regions. Answer. Correct answer. D. Presence of visible overexposure or underexposure artifacts in specific regions. Explanation. The presence of overexposure or underexposure artifacts typically indicates that the exposure technique used was not optimal. These artifacts may appear as areas of excessive brightness, overexposure, or areas that are too dark, underexposure, leading to poor diagnostic quality. Ideally, the image should show uniform dense, clear visualization of both soft tissues and bones, as well as high contrast for easy differentiation of structures. Overexposure or underexposure can mask important diagnostic information and need to be corrected by adjusting exposure factors. Question 7. In what ways can image artifacts affect the diagnostic value of a radiograph, and how should they be addressed? A. Artifacts rarely affect image quality and do not require corrective action. B. Artifacts can obscure critical diagnostic details, requiring the radiographer to retake the image with adjusted technique. C. Artifacts always result in immediate misdiagnosis and should be discarded. D. Artifacts can be ignored if they are confined to non-pertinent areas of the body. Answer. Correct answer. B. Artifacts can obscure critical diagnostic details, requiring the radiographer to retake the image with adjusted technique. Explanation. Image artifacts can significantly impact the diagnostic quality of a radiograph by obscuring critical details such as fractures, lesions, or anatomical landmarks. These artifacts may be caused by issues such as improper positioning, equipment malfunction, or patient motion. If artifacts are is essential for the radiographer to recognize them and correct the exposure technique or reposition the patient as necessary to recapture the image without artifacts. Ignoring artifacts could lead to a misdiagnosis which compromises patient care. Question 8. Given the current trends in digital radiography, how does computed radiography (CR) differ from direct digital radiography (DOCTR) in terms of image acquisition and processing? A. CRU is a cassette-based system that must be manually processed, while DOCTR captures images directly to a digital format without intermediate steps. B. DOCTR requires film-based processing, while CR does not. C. CR captures digital images immediately on the detector without needing a conversion process. D. DOCTR images require a manual processing step similar to CR systems. Answer. Correct answer. A. CRU is a cassette-based system that must be manually processed, while DOCTR captures images directly to a digital format without intermediate steps. Explanation. Computed radiography (CRU) is a photostimulable phosphor plate within a cassette to capture the image, which is then processed digitally once the cassette is inserted into a reader. Direct digital radiography (DOCTR), on the other hand, uses a digital that captures the image directly and immediately sends it to the computer for processing. While both CR and DOCTR are forms of digital imaging, DOCTR eliminates the need for manual processing steps by using the direct capture method. Question 9. In light of recent developments in fluoroscopy, what is the primary concern regarding patient exposure during extended fluoroscopic procedures? A. Fluoroscopy does not expose the patient to any radiation. B. Fluoroscopy causes minimal exposure and is unlikely to affect patient safety. C. Fluoroscopy can lead to excessive patient exposure if not properly managed, especially during prolonged procedures. D. Fluoroscopy exposure can be completely controlled by the radiographer using fixed exposure factors. Answer. Correct answer. C. Fluoroscopy can lead to excessive patient exposure if not properly managed, especially during prolonged procedures. Explanation. Fluoroscopy involves the continuous use of X-rays to produce real-time imaging, which can result in significant radiation exposure, particularly during lengthy procedures. It is crucial to manage exposure effectively, such as by using the lowest possible dose and minimizing the duration of fluoroscopy. The radiographer must continually monitor the patient's exposure and use techniques such as pulse fluoroscopy or intermittent exposure to avoid unnecessary radiation. Question 10. What factors must be considered when developing technique charts for radiographic procedures, particularly in relation to pediatric patients? A. Pediatric technique charts can be identical to those used for adult patients, with adjustments for body size. B. Pediatric charts require adjustments for both body size and tissue density to avoid overexposure. C. Pediatric charts are unnecessary since all pediatric exposures are standardized. D. Pediatric patients should not have specific technique charts, as radiographers should rely on trial and error. Answer. Correct answer. B. Pediatric charts require adjustments for both body size and tissue density to avoid overexposure. Explanation. Pediatric patients require specially developed technique charts that take into account their smaller body size and different tissue densities compared to adults. These adjustments ensure that the exposure factors are appropriately tailored to avoid overexposure, which is especially important in pediatric radiography due to increased sensitivity of children to radiation. A standard adult technique chart would not be sufficient for pediatric patients, as it could lead to unnecessary radiation doses. Question 11. In the context of radiographic positioning, a radiographer is performing an app chest radiograph on a patient with suspected rib fractures. The patient is unable to stand due to pain and weakness. Which of the following should the radiographer do next? A. Perform the radiograph with the patient in the lateral recumbent position. B. Move the patient into a sitting position for better image quality. C. Perform the radiograph using a supine position with appropriate immobilization. D. Delay the examination until the patient is able to stand. Answer. Correct answer. C. Perform the radiograph using a supine position with appropriate immobilization. Explanation. In this scenario, patient comfort and safety are paramount. The patient cannot be moved into a standing position due to pain, so performing the radiograph in a supine position while ensuring the patient is immobilized appropriately is the most effective and safe approach. Immobilization can help reduce the likelihood of motion artifacts. Radiographs should never be delayed unless there is an absolute contraindication, and moving the patient into a sitting or lateral position might compromise the quality of the image and patient comfort. Question 12. When considering the basic principles of radiation protection in radiography, what is the most effective method for minimizing radiation exposure to the patient? A. Increasing the exposure time while lowering the kVp. B. Using the lowest possible dose settings while ensuring diagnostic image quality. C. Minimizing the use of shielding during radiographic procedures. D. Maximizing the distance between the radiographer and the patient during the procedure. Answer. Correct answer. B. Using the lowest possible dose settings while ensuring diagnostic image quality. Explanation. The fundamental principle in radiation protection is to minimize exposure while still obtaining a diagnostic acceptable image. This is achieved by using the lowest exposure factors, kVp, time, that still provide sufficient image quality. Techniques such as increasing exposure time or reducing shielding would increase the exposure unnecessarily, and maximizing distance between the radiographer and the patient is more relevant for personnel protection, not the patient. Question 13. Considering mobile radiography, what is the most important factor to ensure the quality and safety of the procedure when performing an exam in the IQA? Ensure the patient is not disconnected from any life support equipment. B. Ensure the X-ray tube is positioned at a 45-degree angle to the patient. C. Increase exposure time to improve image quality. D. Use a higher setting to compensate for the patient's motion. Answer. Correct answer A. Ensure the patient is not disconnected from any life support equipment. Explanation. In an IQ setting, patient safety is paramount. Ensuring that the patient remains connected to vital life support equipment during the mobile radiographic exam is critical to avoid compromising the patient's condition. While positioning the X-ray tube and exposure settings are important, patient safety regarding life support takes precedence in the IQ environment. Reducing exposure time and optimizing are important for minimizing patient discomfort and maximizing image quality. Question 14. To what extent does the use of a radiographic grid influence the image quality during an X-ray procedure? A. It improves the image sharpness by reducing distortion. B. It reduces scattered radiation, improving image contrast. C. It increases patient exposure without improving image quality. D. It is mainly used in pediatric radiography to improve resolution. Answer. Correct answer. B. It reduces scattered radiation, improving image contrast. Explanation. A radiographic grid is used to reduce the amount of scattered radiation reaching the image receptor, which significantly improves the contrast of the image. Scattered radiation can reduce image quality by causing a foggy or unclear image. Grids are particularly important when imaging thicker body parts or when using higher KVP values. While a grid affects sharpness directly, it helps improve overall image quality by improving contrast. Question 15. Given the circumstances of an elderly patient with degenerative joint disease, what should the radiographer do to minimize the radiation dose during a radiographic exam? A. Use the same exposure factors as for a healthy, younger patient. B. Use higher settings to ensure adequate image density. C. Select the lowest possible KVP and increase exposure time. D. Apply shielding to the affected joints when possible and adjust exposure factors. Answer. Correct answer. D. Apply shielding to the affected joints when possible and adjust exposure factors. Explanation. For elderly patients, especially those with degenerative joint disease, adjusting exposure factors to minimize radiation exposure is crucial. This includes using appropriate shielding to protect areas not being imaged, particularly in sensitive regions. Adjusting the KVP and settings to ensure an optimal balance between image quality. Radiation dose is important. Shielding and careful adjustment of exposure parameters are key to reducing unnecessary radiation while ensuring diagnostic image quality. Question 16. In terms of radiographic image processing, what is the primary effect of increasing the KVP setting on an image? A. It increases the contrast of the image. B. It decreases the image sharpness. C. It increases the amount of scatter radiation, reducing contrast. D. It decreases the spatial resolution of the image. Answer. Correct answer. C. It increases the amount of scatter radiation, reducing contrast. Explanation. Increasing the KVP results in a higher energy X-ray beam, which can penetrate more tissue, but also increases the amount of scatter radiation. Scatter radiation reduces image contrast by exposing the image receptor to radiation that does not contribute to the formation of a diagnostic image. While higher KVP may improve penetration, it may also lead to a decrease in contrast, requiring the use of grids to mitigate scatter. Question 17. Based on the information about radiation protection during fluoroscopic procedures, which of the following is the most effective way to reduce radiation exposure to the radiographer? A. Increasing the patient exposure time. B. Standing behind protective shielding at all times during exposure. C. Using the lowest possible setting during the procedure. D. Placing the image receptor closer to the patient. Answer. Correct answer. B. Standing behind protective shielding at all times during exposure. Explanation. In fluoroscopy, the radiographer's exposure to radiation can be minimized by using protective shielding, such as lead aprons, thyroid shields, and lead glasses, and by staying behind the shielding whenever possible. Radiation exposure decreases dramatically when the radiographer is shielded from the primary beam. Reducing exposure time and using load are important for patient protection but do not necessarily protect the radiographer during fluoroscopic procedures. Question 18. What factors contribute to motion artifacts in a radiographic image? A. Higher kVp and lower settings. B. Patient movement during exposure and improper immobilization. C. Use of automatic exposure control systems. D. Excessive collimation during the exposure. Answer. Correct answer B. Patient movement during exposure and improper immobilization. Explanation. Motion artifacts are primarily caused by patient movement during the exposure process. This can happen when the patient is not properly immobilized, leading to blurring or distortion of the image. While using appropriate exposure factors and collimating the beam may help improve image quality, they do not directly address the issue of motion. Immobilization devices, proper patient positioning, and clear communication are crucial for minimizing motion artifacts. Question 19. When evaluating the quality of a radiographic image, what should the radiographer consider first? A. The image density and contrast levels. B. The resolution of the image and absence of artifacts. C. Whether the image conforms to the standard projections. D. The patient's positioning, accuracy, and alignment of the anatomy. Answer. Correct answer D. The patient's positioning, accuracy, and alignment of the anatomy. Explanation. The most important factor in determining the quality of a radiographic image is the accuracy of the patient's positioning and alignment of the anatomy. Misalignment or improper positioning can lead to distorted images or anatomy being poorly visualized, regardless of other factors like density and contrast. Once the positioning is correct, factors like resolution, contrast, and artifacts can be assessed for quality. Question 20. In response to the increasing use of digital radiography, Dr. which of the following is a major advantage of Dr. over conventional film screen radiography? A. It allows for a reduction in exposure time and patient dose. B. It provides superior spatial resolution with lower noise levels. C. It requires more maintenance and a larger physical space. D. It eliminates the need for periodic quality control checks. Answer. Correct answer A. It allows for a reduction in exposure time and patient dose. Explanation. Digital radiography Dr. allows for a reduction in exposure time due to its higher sensitivity to X-rays. This reduction in exposure time helps minimize the patient's radiation dose. Dr. also provides immediate image preview and post-processing capabilities, enhancing workflow efficiency and reducing the need for re-exposures. However, it eliminates the need for regular maintenance and quality control checks, and while Dr. may offer some improvement in spatial resolution, it does not universally outperform film screen radiography in all situations. Question 21. In the context of the evolution of imaging modalities, Mr. Anderson, a senior radiographer and researcher at an advanced imaging center, has been assigned to prepare a detailed historical review for an upcoming symposium. His project involves analyzing the contributions of early discoveries that led to the modern practices of radiography. Mr. Anderson is particularly interested in understanding which breakthrough had the most significant effect on transitioning radiography from experimental procedures to routine clinical practice, including the improvements in patient diagnostic capabilities. He reviews archival documentation and research articles from the early 20th century and must determine which development most fundamentally transformed radiographic imaging for health applications. A. The invention of portable X-ray machines that revolutionized bedside radiography. B. The discovery and subsequent understanding of X-ray production and interactions with matter. C. The introduction of computed radiography. CR. Systems that improved image processing. D. The integration of digital image acquisition methods in radiology departments. Answer. Correct answer. B. The discovery and subsequent understanding of X-ray production and interactions with matter. Explanation. The discovery of X-rays by Wilhelm Röntgen and the subsequent research into their production and interaction with matter laid the groundwork for all subsequent advancements in medical imaging. This breakthrough introduced the concept of using electromagnetic radiation to visualize anatomical structures, shifting radiography from an experimental procedure to an indispensable clinical tool. While subsequent innovations such as portable X-ray machines, computed radiography, and digital image acquisition are highly significant, they build upon the fundamental principles established during the initial discovery of X-rays. Historical guidelines stress that understanding the origin of radiographic science is crucial for appreciating later technical developments and improvement in patient diagnostic capability. Question 22. Among the various ethical and legal considerations that a radiographer must address, MS Roberts, a lead radiography technician in a busy metropolitan hospital, is involved in a case where a patient's imaging study accidentally revealed an incidental finding unrelated to the original diagnostic query. This discovery places MS Roberts in challenging ethical position regarding patient confidentiality, informed consent, and the obligation to report findings. In light of her training and professional guidelines from organizations such as the ASRT, she must determine which course of action best upholds patient rights while adhering to legal standards. A. Ignore the incidental finding since it is not part of the original diagnostic order. B. Disclose the incidental finding immediately to all hospital staff for further investigation. C. Follow established hospital protocols and legal guidelines, informing the referring physician while ensuring patient confidentiality. D. Report the incidental finding on social media to raise awareness of the potential issue. Answer. Correct answer. C. Follow established hospital protocols and legal guidelines, informing the referring physician while ensuring patient confidentiality. Explanation. In healthcare practice, radiographers are obligated to maintain patient confidentiality and act within legal guidelines. When an incidental finding is identified, the proper protocol is to document the observation and notify the referring physician, who is best positioned to determine the next steps. This approach is in compliance with ethical standards established by professional organizations such as the ASRT, as well as legal considerations regarding patient rights. The other options either breach confidentiality or bypass established channels of communication and are not supported by professional or legal guidelines. The emphasis is on protecting the patient's privacy while ensuring that all potentially significant findings are appropriately managed. Question 23. With respect to X-ray beam characteristics, Mr. Kim, an experienced radiologic technologist, is asked to optimize the exposure parameters for a complex abdominal radiograph. The task is challenging because he must balance the beam's intensity, quality, and spectrum to differentiate between overlapping anatomical structures while minimizing radiation dose. He reviews technical data and standard protocols concerning the use of kilovolt, peak KVP, adjustments, and filtration. Mr. Kim now needs to decide on the factor that primarily influences not only the energy spectrum of the X-ray beam but also affects patient dose and image contrast. A. The image receptor's sensitivity to radiation. B. The patient's body habitus and tissue density. C. The exposure time set by the automatic exposure control. D. The kilovoltage peak KVP setting on the X-ray generator. Answer. Correct answer. D. The kilovoltage peak KVP setting on the X-ray generator. Explanation. The kilovoltage peak KVP is the most critical parameter that determines the X-ray beam's energy spectrum, thereby influencing both the penetration power and the level of contrast in the resulting image. Higher KVP produces beam with broader energy spectrum, which can penetrate dense tissues but may reduce image contrast due to increased. Conversely, lower KVP settings enhance contrast but may compromise the ability to penetrate thicker body regions. Established radiographic principles and guidelines emphasize the importance of KVP in balancing image quality and patient dose. While factors like exposure time, patient anatomy, and image receptor characteristics are important, they ultimately do not have as direct an impact on the energy spectrum as the KVP setting does. Question 24. Through careful analysis of digital image acquisition and processing, Mr. Sanchez, a seasoned radiographer in a high-volume radiology department, is tasked with optimizing the digital workflow for computed radiography (CR) systems. The goal is to reduce image processing time without compromising diagnostic accuracy. In his investigation, Mr. Sanchez must decide which element plays the most substantial role in facilitating the transfer from analog to digital imaging, thereby reducing processing delays and enhancing image quality with post-processing enhancements that did not exist in film screen technology. A. The adoption of direct digital detectors that capture images immediately. B. The increased use of film-based systems that have been digitally scanned for storage. C. The reliance on traditional manual processing methods for image development. D. The integration of digital image processing software that automatically optimizes image contrast and brightness. Answer. Correct answer A. The adoption of direct digital detectors that capture images immediately. Explanation. Direct digital detectors, as seen in direct digital radiography doctor systems, eliminate the intermediate steps required for processing in computed radiography (CR) systems. These detectors capture the X-ray image directly as a digital signal, allowing for immediate image display and further digital enhancements. Although digital processing software, option D, is essential for optimizing image quality, the most significant time-saving factor is the use of direct digital detectors. This advancement streamlines the entire workflow, reducing processing delays and improving overall efficiency in busy radiology departments. The other options rely on either outdated technology or slow processing methods that are less applicable in modern digital imaging. Question 25. When examining the atomic structure and the nature of X-rays, Ms. Patel, a postgraduate student in radiologic science, is exploring the physical phenomena involved in X-ray production. She is particularly interested in how X-rays are generated and the underlying interaction mechanisms with matter. Ms. Patel reviews theoretical models and experimental data that compare the effects of bremsstrahlung radiation with characteristic radiation. In this context, which process is most pivotal in the production of the continuous spectrum observed in diagnostic radiography, and why does it hold significant importance in clinical imaging? A. Characteristic radiation due to electron shell transitions. B. Fluorescence emissions from patient tissues. C. Bremsstrahlung radiation produced when high-speed electrons decelerate in the target material. D. Secondary radiation from scatter interactions in the patient. Answer. Correct answer. C. Bremsstrahlung radiation produced when high-speed electrons decelerate in the target material. Explanation. Bremsstrahlung radiation is generated when high-speed electrons are decelerated upon interacting with the atomic nuclei in the X-ray target, producing a continuous spectrum of X-rays. This process is the predominant source of X-ray production in diagnostic radiography and is crucial because it provides the energy range necessary to differentiate between various tissues based on differential absorption. Although characteristic radiation also contributes to the X-ray spectrum, it is responsible for discrete peaks and is of lesser magnitude compared to the continuous Bremsstrahlung spectrum. The understanding of these interactions is fundamental, as highlighted in radiologic physics guidelines for optimizing image contrast and managing patient dose. Question 26. In light of recent developments regarding the quality control and maintenance of radiographic equipment, Liu, the chief radiology technologist at a large hospital, is tasked with implementing a rigorous quality assurance program. It must ensure that all imaging systems, including digital radiography units and portable X-ray machines, comply with both regulatory standards and manufacturer recommendations. Given the complexity of modern radiographic systems, what is the primary benefit of conducting regular quality control tests as part of an ongoing maintenance program? A. It solely reduces the need for operator training in advanced imaging procedures. B. It ensures consistent image quality and patient safety by detecting and correcting performance deficiencies early. C. It allows for the immediate replacement of all imaging systems without further evaluation. D. It increases the radiation dose to the patient to test the robustness of the equipment. Answer. Correct answer. B. It ensures consistent image quality and patient safety by detecting and correcting performance deficiencies early. Explanation. Regular quality control tests are essential in radiography to verify that imaging equipment performs within acceptable limits. By identifying performance issues or equipment malfunctions early, these tests help maintain consistent image quality and safeguard patient safety. Quality assurance protocols are mandated by regulatory agencies and professional guidelines, such as those from the ASRT and UT, to ensure the equipment operates correctly, thereby minimizing the risk of artifacts, exposure errors, or excessive radiation doses. The other options do not align with the primary objective of quality control, which is to consistently assure optimal performance and safety. Question 27. Considering the interrelationship between different digital imaging systems, Mr. Bradley, a radiologic technology specialist, must explain the fundamental differences between computed radiography (CR) and direct digital radiography. Dr. 2. A group of advanced students. His explanation includes a discussion on workflow efficiency, image quality, and patient dose management. Which aspect most clearly distinguishes doctor from in practical clinical settings? A. Doctor requires a cassette-based system for image capture. B. CR produces images instantly without any processing delay. C. Both systems are identical in terms of processing speed and workflow. D. Doctor captures the image directly on a digital detector, eliminating intermediate steps and thus shortening processing time. Answer. Correct answer. D. Doctor captures the image directly on a digital detector, eliminating intermediate steps and thus shortening processing time. Explanation. Direct digital radiography. Doctor systems use flat panel detectors or similar digital capture devices that convert X-ray energy directly into a digital signal, offering immediate image display and rapid workflow. In contrast, computed radiography (CR) involves the photostimulable phosphor plates housed in cassettes that require an additional processing step to convert the latent image into a digital file. This extra step in CR systems can result in a delay between image capture and review, the efficiency, reduced processing time, and potential for low patient doses in doctor systems are key differentiators noted in current radiographic practices and professional guidelines. Question 20. Throughout the course of a detailed skeletal radiography study, Mr. Emerson, an experienced radiographer, is preparing to image a patient with suspected subtle fractures in the extremities. He must ensure that his positioning technique minimizes distortion and provides a clear view of the bone structures. Given the complex nature of skeletal anatomy and the necessity for precise imaging, which principle of radiographic positioning is most critical for an accurate representation of the targeted anatomy? A. The alignment of the X-ray tube, patient anatomy, and image receptor must be maintained perpendicular to each other. B. Patient positioning can be adjusted arbitrarily to accommodate comfort without affecting anatomical accuracy. C. The image receptor should be placed at an angle to emphasize anatomical landmarks. D. The X-ray tube should be positioned at a variable angle to introduce artistic effects. Answer. Correct answer. A. The alignment of the X-ray tube, patient anatomy, and image receptor must be maintained perpendicular to each other. Explanation. For accurate skeletal imaging, maintaining a perpendicular relationship between the X-ray beam, the patient's anatomical structure, and the image receptor is essential. This alignment minimizes distortion and ensures that the anatomical details are correctly represented on the final image. Deviating from principle can lead to parallax errors and misrepresentation of fracture lines or subtle bone details. Radiographic positioning guidelines emphasize that proper alignment is cornerstone of diagnostic imaging, particularly when identifying fine skeletal pathologies. This approach underpins best practices in radiology and is critical for accurate diagnosis. Question 29. Based on the information about radiographic grids, Dr. Lewis, a consultant in diagnostic radiology, is discussing with his team the advantages and limitations of using grids in various clinical scenarios. In a busy radiology department, he must decide whether the use of a grid is justified when imaging areas that involve both soft tissues and dense bony structures. Which of the following statements best explains the role of a radiographic grid in clinical imaging and the trade-offs associated with its use? A. The grid improves image resolution by focusing X-ray beams into a narrower field. B. A grid significantly reduces scatter radiation, thereby improving image contrast, though it may require an increase in exposure to compensate for X-ray attenuation. C. Grids have no impact on image quality and are used only for patient comfort. D. The use of a grid eliminates the need for other radiation protection measures. Answer. Correct answer. B. A grid significantly reduces scatter radiation, thereby improving image contrast, though it may require an increase in exposure to compensate for X-ray attenuation. Explanation. Radiographic grids are designed to absorb scatter radiation before it reaches the image receptor, enhancing image contrast and detail, especially in regions where both soft tissue and bone are imaged. However, because grids also absorb portion of primary beam, an increase in exposure factors, typically, or exposure time, is often required to maintain adequate image density. This trade-off is an important consideration in clinical practice as outlined in radiographic quality control guidelines and radiation safety protocols. The optimal use of grid is therefore balanced between improving image quality and managing patient exposure. Question 30. When examining the consequences of image artifacts on diagnostic imaging (IMS), Nguyen, an advanced radiographer in a high-acuity trauma center, is tasked with analyzing several cases where artifacts have obscured critical diagnostic details. These artifacts are believed to have resulted from a combination of technical errors, patient movement, and environmental factors. In her review, she needs to determine which measure is most effective, reducing the impact of these artifacts, thereby ensuring that images meet diagnostic quality requirements and comply with radiologic quality standards. A. Increasing the KVP exclusively to overcome artifact-related issues. B. Altering the image processing software settings without revisiting acquisition techniques. C. Implementing comprehensive patient immobilization protocols and optimizing exposure factors to reduce motion-related and technical artifacts. D. Ignoring minor artifacts if they occur in non-critical regions of the body. Answer. Correct answer. C. Implementing comprehensive patient immobilization protocols and optimizing exposure factors to reduce motion-related and technical artifacts. Explanation. Artifacts can severely compromise the diagnostic quality of a radiographic image by obscuring important details. The most effective strategy to minimize these artifacts is to implement robust patient immobilization protocols and carefully optimize factors such as KVP and MAR during image acquisition. This approach addresses both technical and patient-related issues that lead to artifacts, ensuring that the final images are clear and accurate. Radiologic quality assurance guidelines emphasize that preventing artifacts at the acquisition stage is preferable to attempting post-processing corrections, which often fail to recover lost diagnostic information. Ignoring artifacts, even if deemed minor, can lead to missed or misinterpreted diagnoses.